name of that medicine?
Botox.
Oh, okay.
Laura, what's
Yes.
your professional opinion on chiropractic?
Okay, chiropractors. There are some really good chiropractors out there, and a lot of people find significant relief from chiropractors. I don't have any problem with most of them. I think the ones that I get worried about are the ones who say they can cure diabetes, the ones who say, I mean, there are some who go out and start making a list of all the things that they can do, and it's like, okay, you're a magician. So a good chiropractor who doesn't claim to do more than he really is capable of, I think it can be a very useful way to go. But it's the ones that tell you they can do all these wonderful things that I really worry about.
And by the way, if you've been listening, Laura reads our Google listserv. We need more professionals that will read our stuff, because our stuff is real. And I want to just applaud you for reading our stuff, because it is wonderful. And I also know Dr. DeFazio reads our listserv, and every once in a while he would chime in. So it's wonderful if we can get 3, 4, 5, 20 different parts of the healthcare world to get into our world, because we're not looking for free help. We're just sharing, and it's wonderful that you are on the listserv.
Well, it really keeps me grounded. Let me just put it that way. Some of the other medications are out there. I think the NSAIDs, the nonsteroidal anti-inflammatories, the Advil, the Aleve, although Aleve has heart issues associated with it. All of those are useful for short-term use, but I think you've already addressed the concern that if you take too many over time, then there are certainly worries about that. The baclofen pump we've already mentioned, and you've had really good success with that. There is about a 20% problem with it. 20% of people who have them have problems with things like the pump disconnecting, pump infections, and so on and so forth. So it has a high rate of concern with it, but for the people who have it, it has been documented to help pain, and it can be worthwhile. So, but those are all the medical things. And I think one of the things that we know, if you read the literature, is there's almost nothing out there about medical treatment for pain. And one of the other things that has been found in the literature is that people who have CP, very often when they go to the doctor, don't mention chronic pain. They'll talk about the issue that they came in to see the doctor about, but they don't necessarily talk about the chronic pain. And we talked about this a few years ago, and several people at that time told me that that the pain is ongoing, that they don't feel that it's a primary, that there are so many other things going on in their lives that unless it's really excruciating, then it doesn't get brought up. Molly.
Do you see more and more communities developing pain clinics that really just focus on pain? I worked at a county hospital. In about 4 years, they developed a pain clinic that really was beneficial to just, when someone was in pain, they were referred to that clinic to really focus. So do you see more and more of that happening?
There has been a huge explosion in pain clinics, and this is a recognized, and it's, so many conditions and so many people have pain problems that it is something that you're going to see a lot of, and the pain clinics that are out there are viable, and they're things that people work with. And they're there to treat chronic pain. And the good ones, and there are a lot of very good ones, will look at some of the alternative as well as the just plain medical. Because some of them really focus on drugs, and then others look at other strategies as well.
Laura, Dave and I were being rude and talking a second ago. And
I've never seen you be rude like that, Robert.
I know David corrects me on this all the time because he's a mentor. And I know when I had something, I blame it on the CP. And when it's not really should be blamed on the CP, I need to get it checked out. My left shoulder has been killing me for the last 3, 4, 5 months. and it's my CP. Well, I need it checked out, and it's not a rotator cuff, thank God, but it still hurts. But it took David to tell me, boy, you need to get that checked out, and because it's just not your CP, and we need to be aware. Maybe I'm the only hardhead in this room. I seriously doubt it, but we need to be able to isolate what's not our CP.
I think that's a great point, and I remember the physician from Washington University who has CP and was trying to get the doctors. She had new pain, and she kept going in and saying, something's going on, and it took her 1.5 years to have her rheumatoid arthritis diagnosed. And people with CP do get other things. There's a very high rate of breast cancer, for instance, in people with CP, probably related to the fact that many people don't get mammograms when they should. And there are other diseases and conditions that you can get so don't think that just because you have CP you can't get diabetes, and a lot of you said you had diabetes. I heard there were several of you said you had asthma. So there are other things that you can get that can cause pain, and don't be like the docs and blow it off to all CP when you're hurt, because it certainly could be something else. That's a great point. Thank you for bringing that one up. I did make a list of some of the other treatments that are out there, and these are, again, very much on the alternative side, most of them anyway. But let's walk through them fairly quickly. How much time do I have, Robert? 15 minutes, okay. I want to tout exercise, and I'm really glad to hear some of you talk about the fact that you are exercising. We did a study in Birmingham a few years back looking to see if, in fact, regular exercise helped pain. And actually what it did best was it helped fatigue a lot more than it helped pain. But again, for those of you who are in one position for long periods of time, getting up, getting out of that position, and several people I talked to this morning talked about it was hard to get motivated to exercise, and that's true for a lot of people. But it can help your health in so many ways, and pain is only one. Pain and fatigue are our two primary sources. Some of the things that we don't know about exercise are what are the best forms of exercise, because you certainly worry about too much resistive exercise when you have joints that maybe aren't as good as they should be from years of moving too strongly or stepping too hard. So you have some things to be a little bit concerned about. But even if you just did a simple aerobics program, the pool is the best. But again, it's all those things of having to get in and out of the water. Sometimes many of you are going to need additional help and so forth. So those are hard. It doesn't mean you have to go to a fitness club. There are a lot of exercise videos out there now. We have a lot of people using the Wii Fit. The problem with the Wii Fit for me is that button is so small, it's really hard to manipulate. And I think for some of you who have difficulty manipulating things, the Wii Fit has its own set of headaches. But again, there are videos, DVDs, and so forth, or even just moving on your own, taking 15 minutes in the morning to just plain move are things that would really, really be beneficial for you. So exercise is really up there as one of the things that can really help. Now, biofeedback, and we had a presentation here, was it 3 years ago? I think, on the use of biofeedback in pain, and there have been just 1 or 2 studies that suggest that biofeedback can help. It's expensive. It means you have to go to somebody who knows how to do it. Not all of your insurance companies are going to pay for it, and I don't think Medicaid will cover biofeedback. But it's a possibility, so that's one option that's out there. Another one that we haven't explored very much is acupuncture. And acupuncture has caught on. What is biofeedback? Okay, good question. Biofeedback is you get a sensor put on that collects some information. And it's usually, most of the information that we get from biofeedback is how tight your muscles are. Okay, and you can control, if you sit and think and relax, you can limit the stiffness and the tightness in your muscles consciously, and then consciously control the contraction over time, and that will decrease the pain. Or there has been a suggestion that it can. And usually if you learn biofeedback, you can learn to relax over time. So it really is another way to help you learn to relax. That gives you a visual feedback, if you will. Is that? Okay. All right. Acupuncture is the other one, and acupuncture and chiropractor I would put together because they have really started to catch on. We don't have any real studies on acupuncture and its use in CP and whether or not it helps with pain. But it's certainly one, when I was in China, we spent some time in acupuncture clinics. And I do believe that it has a potential for usefulness. Most people don't really like the idea of having a bunch of needles stuck in a joint. But the people I know who have had it done say that it's really not so bad. Now, Robert, with your startle, I don't know. You might just come right up out of the chair when they stick a needle in. So if you startle, it may not be the greatest way to go. But it's one I would say consider. We don't have a lot of information on it, but it's a possibility. Now, the guided imagery stuff, if any of you are familiar with cancer treatments, there's a guy named Bernie Siegel who's done a lot with guided imagery. And guided imagery was what I used, along with massage, when I was having pain. Is he from Missouri? Philadelphia? I don't know where he's from. That could be the case. He's a well-known cancer doctor, and he's got all kinds of things out there. And he talks a lot about healing and so forth, and some of that goes a little far for me, but he's got some tapes that you can play. And it's one of those things that you need to do in a very relaxing atmosphere. I did mine lying in bed, but you can also do them sitting up. And basically what he does is if you can sit there and go with what he's talking about, it takes you out of yourself. And it's kind of, I think, what Molly was talking about when she talked about relaxing, is that you have to get your mind in the right place to really do guided imagery. And it's not a one-shot fits it. It's one of those things that you have to practice over and over again over time. But it personally really got me to the point that I was pain-free, even before I got to the surgery, most of the time, if not all of the time. So again, you need a tape, or you could actually do it with another person talking you through it, although I think it would be